So let's talk about running related injuries and what do we do? What do we look for? And kind of what's the direction that we go when we see a running related injury? So the first thing to talk about is that running related injury is an injury that you sustain while running. Okay. It's not that you slipped and fell off the curb or came coming down the stairs and then that is bothering you while you're running. No, a running related injury is something that occurs when you're running or immediately following running activity. Okay. Then we have to determine which route are we going to go? Is it a soft tissue injury or is it a bone injury? We treat these for the most part completely different. There's a lot of similarities as we get down the road, but we treat these differently. In general, kind of generalizing here, bone injuries progressively get worse as you add increased load. As you run more, the bone injury gets worse. Soft tissue injuries, a lot of times you have that, we'll describe it as like it kind of warms up, right? It's bad at the beginning when I first start running mile, half mile, 2 miles or so, and then it gets better. And then maybe towards the end, it starts to bother me again. That's more of a soft tissue in general, more of a soft tissue injury. Bone injury, a lot of times it's just going to crescendo, it's going to get worse and worse as the run goes on. We also will think about it as kind of where and how it hurts. So if it's like pinpoint and it's sharp stabbing pain, a lot of times that's more of a bone injury. You can kind of isolate this one spot. If it's kind of a generalized ache, maybe some like throbbing discomfort, that's a lot of times more of a soft tissue injury. So again, we've got some things that just kind of like general rules, doesn't tell us yes or no either way. We have other things that we want to look at, but generally those are the kind of routes that we're going to look at. Bone injuries get worse as the run goes on. They're isolated sharp stabbing pain. Soft tissue injuries a lot of times tend to have that warming up sensation, and they're more generalized achy sensations. So if we kind of find that fork in the road, is it bone injury? Then we need to take some time off. We need to take load off of that region to allow it to recover. That doesn't mean that we're just complete rest, sitting on the couch watching Netflix. That means that we're taking off the stimulus from a deloading standpoint, what's causing the injury, running. Okay. There's other things that we can do, other things that we can progress from therapy standpoint. Second thing is if it's a soft tissue injury, then a soft tissue injury, we've got to find the next road. So this is a longer progression of activities. The main thing we want to do with a soft tissue injury is get you back to run. Okay, the first thing we want to do is get you back to running. There's a pain scale. There's an acceptable level of pain depending on what we're in. If you have a bone injury, the acceptable level of pain is a 0 out of 10. If it's above a 0, that's not acceptable. We need to back off until you feel a 0 out of 10. That means that we're allowing for recovery to occur. With a soft tissue injury, we are actually accepting up to a 3, 5 out of 10 pain. That's okay. 3 out of 10, totally fine. That up to a 5 out of 10, we've got to kind of keep an eye on things and potentially manage, shift around what we're doing. But having some level of pain with a soft tissue injury is okay. That doesn't mean that things are getting worse. It doesn't mean that you're causing more harm. That means that we're loading the tissue enough to create change, as long as we can get it to that level and then let it back off. Okay. So that's another differentiation that people are generally afraid of. 0 out of 10 is not the answer. Bone injuries, 0 out of 10 is what we need. Soft tissue injuries, we are okay with having a little bit of pain. It's about 3 out of 10 or so. Once we kind of have that discussion, we know that we want to get you back running, because running is the stimulus that we need to impose on the body to get you tolerant to that activity, right? So that you can get back to your training, get back to your racing, get back to living the life that you want to live. So once we get you back to running, we then have to modify that running somehow. So that could be modifying your form, right? A lot of times we can change your running gait and change your running form to shift that load off of the region that's uncomfortable. Maybe put those loads elsewhere just to keep you running at a lower level of discomfort. But we may also have to change a parameter of running. So how far are you running? How fast are you running? What surface are you running on? All of those things can be, and I guess frequency, how frequently are you running? All those are things that we can modify to keep you running. The number one goal is to keep you running, right? So if we can modify any of those parameters, shift around your running form, change those forces, that's the way that we want to go. So we know it's soft tissue. We know we want to keep you running. We know we probably have to change the running in some capacity, form, or parameters. The next thing we have to do is we have to load. We have to get some sort of external load. We have to work on the limitations in that region, that isolated tissue that is problematic. So we want to load the tissue with the issue. Okay. So if we know that we're having a hamstring discomfort, we need to get some load to that hamstring. We need to build up that hamstring's tolerance and that hamstring's resiliency to activity. So how do we do that? We try to get as heavy of load as possible, through as much range of motion in a controlled fashion. So we want heavy load in a controlled and slow manner. to start out with. We want that tissue to go through a lot of load over a longer duration of time to help desensitize the tissue, to help build up capacity, build up tolerance within that tissue. Okay, so we go back. We have a running related injury. We have to find the fork in the road. Bone injury, 0 out of 10 pain is acceptable. We don't want any pain. Those generally get worse as the activity goes on. They have that pinpoint sharp stabbing pain. The other side is going to be a soft tissue injury. We're accepting upwards of like a 3 out of 10 pain. That is okay. You are not making things worse if we're in that category. Then we have to get you running, okay, get you back to the activity that's problematic, modify that running somehow, whether it's form or parameters, and then get you loading the tissue in a slow and heavy fashion.